Good evening, my dear children. Hope you all are fine. Now we are going to discuss about Wilms tumor. So Wilms tumor or nephroblastoma is a highly malignant embryonal neoplasm that may involve one or more kidneys. It is an embryonal neoplasm, highly malignant embryonal neoplasm that may involve one or both kidneys. The etiology is unknown or genetic predisposition are there. The incidence is, it is the second most commonest abdominal neoplasm in children and usually unilateral, but in 10% cases it may be bilateral, and it is commonly affecting the left kidney than the right, and it affects commonly the children between 3 to 5 years. It rarely develops after 8 years of age and occurs about 1 in 2 to 2.5 lakhs. Then the pathophysiology. Because of the development of the tumor within the kidney parenchyma, there will be distortion and invasion into the surrounding tissues. Okay, because of the development of the tumor within the kidney parenchyma, there will be distortion or there will be disturbance or there will be invasion of the neoplasm to the surrounding tissues. So the tumor tends to grow and invade into the adjacent renal parenchyma, and there will be formation of a capsulation, and it will result in hemorrhage, necrosis and calcification of the kidney, and it will finally result in metastasis. The clinical manifestation are abdominal swelling or mass, large, smooth, fixed, firm, non-tender, confined to one side. That is, we can, while palpation, actually we are not allowed to palpate the kidney if there is any doubt of Wilms tumor. So, abdominal swelling or mass, it is large, smooth, firm, non-tender, confined to one side. Then increased abdominal girth will be there. Then superficial venous engorgement, then hematuria, fatigue and malaise, then hypertension, occasional hypertension, weight loss, fever. Then if metastasis, there will be symptoms of lung involvement. Then dyspnea, cough, shortness of breath, chest pain sometimes. Then next is the clinical staging. So first is the stage 1. Stage 1, we can see the stage 1 Wilms tumor in 43% of the patients. Here, the tumor is limited to the kidney and can be completely excised. We can excise or we can remove the tumor from the kidney, and it is limited to the kidney only. And the surface of the renal capsule is intact. There will not be any metastasis. The tumor is not ruptured or biopsied prior to removal. We must not do any biopsy, or it must not be ruptured before removal of the tumor. And there is no involvement of the renal sinus vessels or renal blood vessels, and there is no residual tumor apparent beyond the margin of excision. That means we can completely remove the tumor because of the margin. There will not be any extra invasion. This is this type of tumor. This is stage 1 Wilms tumor can be seen in 43% of the cases. Then stage 2, it can be seen in 23% of the patients. The tumor extends beyond the kidney. It is not confined to the kidney itself. It extends beyond the kidney, but it is completely, we can completely excise it or we can completely remove it. There is no residual tumor apparent at or beyond the margin of excision. That is, there will be a well-defined capsule, and the vessels outside the kidney are either infiltrated or contain tumor thrombus. So the vessels are also involved here. So any of the following conditions may also exist: tumor involvement of the blood vessels of the renal sinus or outside the renal parenchyma. Then tumor has been biopsied prior to removal. It may be biopsied, and there is a local spillage of tumor during surgery, confined to the flank. Then stage 3. Stage 3 Wilms tumor can be seen in 23% of patients. There will be residual non-hematogenous extension of the tumor confined to the abdomen. That means there will not be any involvement of the blood. That is, it is not affected to the blood. There is non-hematogenous extension, but the tumor will be extended up to the abdomen. And the involvement of hilar, periaortic and other lymph nodes are also there. Then the tumor cannot be completely resectable. It is not completely resectable or excised because of the local inflammation into the vital structures or vital organs. So because of the local inflammation, we can't resect the tumor completely. And there is positive surgical margins. The tumor spillage involving, there will be spillage, or while the tumor removal, there will be spillage including peritoneal surfaces either before or during the surgery, and it is transected tumor thrombus. Then stage 4, it can be seen in 10% of patients. There will be hematogenous metastasis. That means the blood vessels and lymph nodes are also affected. That is, lung, liver, bone and brain are also affected in the stage 4 Wilms tumor. or the lymph node metastasis outside the abdominopelvic region. Then stage 5 is, we can see in 5% of patients, bilateral renal involvement. That is, it is very rare that we can see bilateral involvement of the kidneys, which occur in 5 to 8% of cases, and at the time of initial diagnosis itself we can find it out. The next is the diagnostic evaluation. So there are 5 stages. In stage 5 only one kidney is affected and the tumor is only confined to the kidney. Stage 2, the tumor, here also the kidney, the tumor extends beyond the kidney, but there is not any, that means that it is well capsulated and it will not affect the blood vessels or adjacent organs. Then in stage 3 also there is not any involvement of the hematogenous system, but there will be involvement of the but this it will be extended up to the abdomen. In stage 4 there will be hematogenous metastasis involving other organs like lung, liver, bone and brain. Then in stage 5 there will be bilateral renal involvement. Then diagnostic evaluation, history collection, family history of any cancer, physical examination, presence of abdominal mass, hypertension, then congenital anomalies, then signs of malignancy, weight loss. These all can be found out in the physical examination. Then hematological studies, like in hematological studies there will be results like polycythemia, excess erythropoietin, excessive burn, then creatinine and CBC will be abnormal. Then urine analysis and biochemical studies, there will be presence of blood in the urine. Then X-ray abdomen and chest, the size of the liver and spleen can be seen. Hepatosplenomegaly can be seen. Then indications of anemia, lymphadenopathy. Then abdominal ultrasound to rule out any presence of the extension of tumor to the abdominal cavity, computed tomography, then MRI scan, then renal function test, liver function test, then bone marrow studies, and also vena cava. Vena cava, it is a visualization of the inferior vena cava to presence extension of tumor to the vena cava. And management includes radiation therapy, chemotherapy and surgery. So radiation therapy, it helps in the regression of the tumor size. We can decrease the size of the tumor, and it is indicated for children with bilateral tumor or tumor size is larger and inoperable. If the tumor is not operable, or if there is bilateral that is, if there is bilateral involvement, we can do radiation therapy. Then chemotherapy, it can be treat any metastatic lesion that exists, and there will be along with chemotherapy we can do partial nephrectomy. That is, after partial nephrectomy for bilateral tumor we can do chemotherapy, and chemotherapy or radiation therapy is indicated after surgery. So next is management to the stages. That is, in the first stage we can do radial nephrectomy. That is 18 weeks of chemotherapy depending on the age of the child and weight of the tumor. Then stage 2 we can do nephrectomy plus abdominal radiation plus 24 weeks of chemotherapy. In stage 3 there will be abdominal radiation plus 24 weeks of chemotherapy plus nephrectomy after the tumor shrinkage. Then stage 4 nephrectomy, along with that there will be abdominal radiation, then 24 weeks of chemotherapy, then radiation of the metastasis, abdominopelvic region. Then in stage 5 individualized treatment based on the tumor burden. That's all about the Wilms tumor. Hope you all have understood the topic. If you have any doubt you can ask me. Thank you.